Hi, I'm Dr. Jamie Kearns. I'm an assistant professor of urologic oncology at Levine Cancer Institute in Charlotte, North Carolina. In this video series, I'll be answering the most common questions I get about prostate cancer in my practice. Today's video focuses on PSA, or prostate-specific antigen. I'll cover what PSA is and how it's monitored, what an elevated PSA might mean, and also what it does not mean, and what you should do next if you have an elevated PSA. What is PSA and how is it monitored? PSA is a protein produced both by cancerous and non-cancerous tissue in the prostate. If you have a prostate, then you have a PSA level. Your PSA levels are determined with a simple blood test. Starting around age 50 or earlier, if you have a family history or are of African descent, men should consider having their PSA monitored as part of an annual checkup with their primary care provider. The decision of whether or not to test your PSA should be a discussion between you and your primary care provider. The frequency of how often to check your PSA has been a topic of debate over the last several years and should be individualized for each person. What is an elevated PSA? What does an elevated PSA mean? And what does it not mean? A normal PSA level depends on an individual's personal characteristics and must take into account family history, race, and age. For instance, a patient's PSA level may have gone up year over year at a high rate, but not in absolute terms be considered high. This could still be a reason for recommendation for prostate biopsy. It is not helpful to compare your PSA number to anyone else's to try and determine your risk or diagnosis of prostate cancer. In fact, the best method to determine your specific risk for prostate cancer is to use one of the calculators linked above or in the description below. What does an elevated PSA mean and not mean? An elevated PSA means you should have a discussion with your primary care provider about whether you should be referred to a urologist for further workup. It does not necessarily mean you have prostate cancer. The only way to know for certain if you have prostate cancer is with a prostate biopsy. Thank you so much for watching this video on PSA. PSA screening is a vital part of monitoring men's health and early detection of prostate cancer. If you have more general questions about prostate cancer, please see the other videos on my channel. If you have ideas for a future video, please leave them in the comments.